HSG, hysterosalpingography. Imagine you've been trying to conceive for months, maybe even years. You've done all the blood tests. You've tracked your cycles. But the question remains, are my tubes open? That's where a simple but powerful test called HSG steps in. It's like taking an X-ray snapshot of the hidden pathways that could be standing between you and your dream of becoming a parent. What is HSG in human terms? HSG, or hysterosalpingography, is not just another test, it's a window into a woman's womb and fallopian tubes. Using a special dye and X-ray, doctors can see whether the womb, uterus, has a normal shape, whether the tubes that carry eggs are open or blocked. Think of it like a plumber checking the water pipes, except here, the pipes are the fallopian tubes that connect the ovaries to the womb. Hysterosalpingogram, an X-ray procedure using a special dye to examine the uterus and fallopian tubes, primarily used to assess infertility by checking for blockages, structural abnormalities, or scarring. The procedure involves injecting dye through the cervix to visualize the shape of the uterine cavity and the patency, openness, of the fallopian tubes. It can also confirm the complete blockage of tubes after tubal ligation, or assess the uterine cavity for issues like polyps or fibroids. Why do doctors recommend HSG? The reasons are very personal and important. Difficulty conceiving, infertility workup. If pregnancy isn't happening after trying for a year, HSG can reveal why. History of miscarriages. It checks for abnormalities in the uterus, suspected blocked tubes, past infections, pelvic inflammatory disease, or surgery may have caused scarring. Before fertility treatments. To guide IVF or IUI decisions. Positive outcomes and benefits. Clarity and answers. For many women, it ends months or years of guessing. Treatment planning. It helps the doctor decide the next best step. Sometimes it helps fertility. Interestingly, the flushing effect of the dye can actually open up minor blockages, leading to surprise pregnancies within months after the test. Implications. A normal result can bring relief and reassurance. You know your tubes and womb are healthy. An abnormal result doesn't mean the end of the road. It simply points doctors to targeted treatments like surgery, IVF, or other fertility support. It empowers couples with knowledge and direction, instead of uncertainty. Possible complications, though rare. Every procedure has risks, but most women get through HSG safely. Possible issues include pain or cramping during the dye injection, like strong period cramps. Light vaginal spotting after the test. Allergic reaction to the contrast dye, rare. Infection if bacteria are accidentally introduced. Very rarely, injury to the uterus. When is it not done? An HSG is contraindicated, should not be performed. If you have a known allergy to the contrast dye, a current pelvic infection, and a known pregnancy. Why is it done? To investigate infertility. To see if the fallopian tubes are blocked or if there are uterine abnormalities that prevent pregnancy. To check for uterine problems. To detect abnormalities like polyps, fibroids, or scarring within the uterus. To assess post-sterilization. To ensure that fallopian tube blockages are complete after a tubal sterilization procedure. To investigate recurrent miscarriages. To rule out uterine conditions that may contribute to miscarriages. HSG may sound intimidating, but for many women, it's the turning point that brings them closer to holding their baby. Knowledge is power, and this test is one of the most direct ways to understand fertility challenges. If you or someone you love is struggling to conceive, don't be afraid to ask about HSG. It might just be the missing puzzle piece.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.